Alabama has 1,925 nurse practitioners to diagnose, treat, and manage acute and chronic conditions affecting diverse populations. Rural healthcare clinics established by nurse practitioners provide care to patients in underserved areas that otherwise would not have access to care. In Alabama, 57 of 67 counties are considered rural. 2,061,567 residents, or 44% of the state's population, live in rural areas. In 2004, Alabama had only one primary care physician for every 2,200 citizens. 9 of Alabama's counties do not have hospitals. 35 of 57 rural Alabama counties do not provide labor and delivery services. Access to health care is limited in these areas. Nurse practitioners are able to open the door to access to care by serving in these areas. We can help decrease the health care costs in these areas by focusing on prevention of disease complications, therefore reducing unnecessary hospitalizations, emergency room visits, and uncontrolled chronic illnesses. One of the challenges for nurse practitioners in the state of Alabama is treating patients as a primary care provider is the inability to prescribe controlled substances. If a nurse practitioner sees a cancer patient or a patient with chronic pain or a terminal illness, they are not allowed to prescribe the medications necessary to control their pain. The nurse practitioner must wait and find a physician to write for the controlled substance to control the patient's pain. Patients deserve not to have to wait for their pain medications. Florida and Alabama are the only 2 states in the nation in which nurse practitioners cannot prescribe controlled substances. In Alabama, nurse practitioners are 1,925 voices strong, but our voices are drowned out by the voices of the Alabama Medical Association and its lobbyists. We have been fighting for prescription authority for the last 10 years. These medications are needed to treat the patients we treat. Alabama is ranked 51st in the country for restrictive nurse practitioner regulations for consumers. The ranking of 51st earns Alabama an F for severely limiting patient choices, and Alabama earns a 5 out of 30 for patient access to prescriptions. The American College of Physicians released a policy monograph in 2009 recognizing nurse practitioners as primary care providers, equal in care to physician counterparts, and endorsed efforts to support healthcare collaboration. The American College of Physicians stated, an anticipated shortage of primary care physicians has led to policymakers to consider the role of nurse practitioners in improving access to primary care. In 2003, Representative, now Governor Robert Bentley requested a task force to review the prescription authority of nurse practitioners in Alabama. The task force consisted of physicians and nurse practitioners. In 2004, the task force recommended a change in Alabama law to allow Alabama nurse practitioners to prescribe controlled substances. The bill was introduced but failed to pass. The bill has been reintroduced every year since but has failed to pass. The Alabama Medical Association continues to lobby every year to kill these bills. When asked to comment on their reasoning for the Alabama Medical Association issued the following statement. Nurse practitioners are not qualified to prescribe controlled substances. Nurse practitioners do not have the training or the qualifications to prescribe controlled substances. If nurse practitioners want to prescribe controlled substances, they should attend medical school to receive the proper training to do so. Another barrier for nurse practitioners in providing care in rural areas is insurance companies in Alabama are not required to recognize nurse practitioners as primary care providers. Many third-party payers do not recognize nurse practitioners as providers of health care. Many insurance providers, including Medicare and Medicaid, do not provide direct payment to nurse practitioners in Alabama. So we must work with these insurance companies to recognize nurse practitioners as health care providers. In order to improve Alabama's healthcare system and improve access to care, nurse practitioners in Alabama need The authority to prescribe controlled substances be included in Alabama's Insurance Act as healthcare providers, be included in payer panels including Medicaid managed care. With legislative action, nurse practitioners will provide much-needed solutions to the Alabama healthcare crisis.